puffy eyes when you wake up, muscle cramps out of nowhere, urine that leaves a stubborn layer of foam behind after you flush. Any one of those alone might mean nothing, but for seniors, that combination can be your kidneys quietly asking for help, long before a blood test catches it. Today, 6 signs your kidneys may be sending you right now. By sign number 1, you'll know about a 15-second look in the toilet bowl that tells you more than most people realize, and exactly what it does and doesn't mean. But first, tell me in the comments, have you ever noticed foam in your urine that sticks around after you flush? I read every comment, and it shapes what we cover next on this channel. Your kidneys work in near total silence. They filter waste, balance your electrolytes, and control how much fluid your body holds onto, all without you noticing a thing, day after day, for decades. That silence is exactly what makes kidney disease so easy to miss. An estimated 37 million Americans, roughly 1 in 7 adults, live with chronic kidney disease, and as many as 9 in 10 of them don't know it. Kidney disease becomes far more common with age. It's most prevalent in adults 65 and older, more than in any other age group, which is exactly why these 6 signs matter most for the audience watching right now. Part of why kidney disease hides so well is that the kidneys have enormous reserve capacity. A person can lose a significant portion of their kidney function and still test within a broadly normal range on a standard blood panel, because the remaining tissue quietly compensates. That compensation is remarkable, but it also means many of the earliest clues show up as small physical changes long before a lab value crosses an official threshold, which is exactly the gap this list is built to close. None of these 6 signs is a diagnosis by itself. Each one, though, is a clue your body is genuinely capable of noticing, long before a lab report confirms anything. We'll go from 6 down to 1, and the final sign is something you can check for yourself tonight in your own bathroom in under a minute. Each sign gets the same treatment: what it actually is, why it happens, what a normal version looks like versus a concerning one, and one specific thing you can do about it today. Let's start with sign number 6. Picture someone who wakes up most mornings with eyes so puffy that friends ask if they've been crying, even on an ordinary day. That kind of swelling isn't about sleep position or salty dinner alone. Your kidneys are supposed to keep protein locked inside your blood vessels, where it helps hold fluid in place, the same way a sponge holds water. When the kidneys' filters get damaged, protein starts leaking out into the urine instead of staying where it belongs, and fluid follows it out of the bloodstream and into nearby tissue. The skin around the eyes is thin, loose, and low in fat compared to the rest of the face, which makes it one of the very first places that shift becomes visible, well before swelling shows up anywhere else on the body. This sign tends to show up earlier than people expect. Puffiness around the eyes can appear even before someone notices any change in how often they urinate or how they feel overall, which is part of why it gets dismissed so easily. Lying flat all night lets fluid settle in the face, so the puffiness is usually worse right after waking and eases somewhat as the day goes on. A simple habit helps here. Take a phone photo of your face each morning for a week in similar lighting and compare them side by side. Note whether the puffiness fully clears by midday or lingers longer as the days pass. Pay attention to whether it's confined to just your eyelids or has started spreading toward your cheeks, since a wider spread often means more fluid has shifted than before. There's an emotional side worth naming here too. Puffy eyes are easy to write off, especially for anyone who's already dealing with allergies or a demanding sleep schedule. And most people simply reach for an eye cream and move on. That instinct makes sense, but it's also exactly the kind of small, easy-to-dismiss clue this list is meant to catch before it grows into something bigger. It's worth being fair to the alternatives before jumping to conclusions. Allergies, a poor night's sleep, crying, or too much sodium the night before can all cause a similar look. Most morning puffiness is unrelated to kidney function entirely. What separates the two is persistence. Puffiness that keeps returning most mornings, that doesn't respond to the usual allergy remedies, or that starts spreading beyond the eyes is worth bringing up with your doctor directly. A cool compress can tell you something too. If it brings quick, lasting relief, that leans toward an ordinary cause, while puffiness that returns the very next morning, regardless, leans the other way. This video is for general education, not a diagnosis, and any ongoing swelling is worth mentioning at your next appointment. 6 down. Sign number 5 shows up somewhere you'd never think to blame your kidneys for, your calf muscle at 2 a.m. Now imagine someone jolted awake by a calf cramp so sharp they have to sit up and stretch it out, 2 or 3 nights a week for no obvious reason. Occasional cramps are normal. A pattern that's becoming a habit is worth a second look. Healthy kidneys keep a careful balance of electrolytes in your blood, minerals like calcium, potassium, and phosphorus that your muscles and nerves depend on to fire correctly. When kidney function slips, that balance can drift in either direction, and the nerves controlling your muscles start misfiring, which shows up as a cramp. The mineral side of this is more specific than most people realize. Elevated phosphorus is one of the more common electrolyte shifts in kidney disease, and it can trigger cramping along with itching and bone discomfort, the same phosphorus buildup that shows up again in sign number 4. Low calcium, which often follows as kidney function declines and vitamin D activation drops off, adds to the same problem from a different angle, lowering the threshold at which nerves fire and making cramps more likely to strike without warning. Try keeping a quick log for 2 weeks. Which nights you cramp, which muscle, and roughly what time. A pattern clustering in the same muscle group, especially overnight, gives your doctor something concrete to test for rather than a vague complaint about cramping sometimes. It also helps to note anything unusual about the day beforehand, such as a particularly salty meal or a missed dose of a regular medication, since that context can help separate a one-off cramp from a genuine pattern. To be fair, most nighttime leg cramps have nothing to do with the kidneys. Dehydration, overexertion, certain blood pressure medications, and simply getting older are far more common explanations, and gentle stretching before bed resolves most of them without any further investigation. What changes the picture is frequency and company. Cramps that are increasing, that show up alongside puffy eyes, or the signs still ahead on this list, or that don't respond to normal stretching and hydration, are worth a blood test rather than another bottle of magnesium supplements. A pharmacist can also flag whether a current medication, certain diuretics in particular, might be contributing, which is a useful first stop before assuming the worst. As always, this is educational content, not medical advice, and persistent cramping deserves an actual conversation with your physician. 5 down. Sign number 4 is the one people spend the most money on lotion trying to fix. Think about someone who's gone through 3 different lotions this year, certain their skin is just getting older and drier, and still can't shake a persistent itch across their arms and back. Ordinary dry skin responds to moisturizer within days. Kidney-related itching, doctors call it uremic pruritus, often doesn't because the itch isn't actually coming from the surface of the skin at all. When kidneys can't clear waste products efficiently, those toxins build up in the bloodstream, a condition called uremia, and that buildup appears to irritate nerve endings from the inside out rather than causing any visible rash. Mineral imbalances layer on top of that. Disrupted calcium, phosphorus, and magnesium levels are all linked to worsening itch, the same imbalances behind the muscle cramps in sign number 5. This combination is why lotion alone often falls short. You're treating the skin's surface for a problem that's coming from inside the body, which is also why the itching so often persists, no matter how thick or expensive the cream. There's a useful distinguishing detail worth knowing. Uremic itching tends to be more widespread rather than confined to one patch, often affects both sides of the body at the same time, such as both arms or both legs, and doesn't come with an obvious rash the way allergic itching usually does. It's also more likely to intensify at night, which can make sleep genuinely difficult even when the skin looks completely normal to the eye. A practical next step: if your itch has lasted more than a few weeks, isn't improving with regular moisturizer, and doesn't match a rash or bug bite you can point to, mention the specific pattern, both sides, no visible cause, not responding to lotion, at your next appointment, rather than describing it simply as dry skin. That level of detail helps a doctor decide quickly whether blood work checking your mineral levels is worth ordering. To be clear, most itchy skin in older adults isn't kidney-related at all. Naturally thinning skin, dry winter air, certain medications, and other skin conditions cause far more itching overall than kidney disease does. The kidney-related pattern stands out mainly through that combination of persistence, symmetry, and resistance to ordinary moisturizing, rather than through severity alone. This is general education, not a diagnosis, and ongoing itching is worth raising with your doctor regardless of the cause. 4 down. Sign number 3 changes how your favorite meal actually tastes, and it has nothing to do with the cook. Consider someone who used to look forward to dinner and now pushes food around the plate, convinced their favorite dishes have started tasting slightly off, almost metallic, for no reason they can explain. That shift in taste is a genuinely documented early symptom of kidney trouble, not a change in the recipe. Waste products the kidneys would normally clear, urea in particular, build up in the bloodstream and change the chemistry of saliva itself, which alters how taste receptors interpret ordinary food. Meat is often the first food to go, which can be an easy detail to overlook until someone realizes they've quietly stopped ordering it. This symptom is common enough that specialists ask about it directly. Roughly 1 in 3 people with kidney disease report noticeable taste changes, ranging from blandness to a persistent metallic edge, according to a nephrologist quoted by Kidney Care UK. Once appetite drops because food simply doesn't taste right anymore, unintentional weight loss and poor nutrition often follow close behind, which makes this sign worth catching early rather than adapting around quietly. There's an emotional layer worth naming honestly. People often blame themselves here, assuming they're just losing their taste for food as they get older, or trying new seasonings to compensate without ever mentioning it to a doctor. That's an understandable response, but it also means a genuinely useful clue goes unreported for months or years. The practical move is specific. If food has started tasting metallic, bland, or simply wrong over the past few months, and appetite has dropped along with it, say those two things together at your next visit, rather than mentioning them separately or not at all. It's also worth thinking back to whether one particular food, meat is a common one, has started tasting noticeably worse than everything else, since that specific detail can be a useful clue on its own. Plenty of ordinary things affect taste too, including medications, dental issues, sinus problems, and zinc deficiency. So this sign alone isn't proof of anything. But paired with any of the other signs on this list, particularly fatigue or changes in urination, a fading sense of taste moves from an odd inconvenience to something worth naming directly. Checking with a pharmacist about whether a current prescription lists taste changes as a side effect is also a reasonable first step, since several common medications for blood pressure and cholesterol can cause a similar effect. As with every sign here, this is general information rather than a diagnosis, and unexplained appetite loss always warrants a conversation with your physician. 3 down. Sign number 2 is the one almost every senior has felt at some point, and almost everyone blames on simply getting older. Imagine someone who used to finish the crossword before breakfast without a second thought, and now finds themselves rereading the same clue 3 times, running on a kind of tiredness that a full night's sleep doesn't fix. This particular fatigue has a specific biological cause worth knowing. Your kidneys produce a hormone called erythropoietin, which tells your bone marrow to keep making red blood cells. When kidney function declines, erythropoietin production drops with it. Fewer red blood cells get made, and less oxygen reaches your muscles and your brain, even though nothing about your lungs or your heart has necessarily changed. This mechanism explains why the tiredness often comes bundled with mental fog rather than showing up as fatigue alone. Reduced oxygen delivery to the brain can affect concentration, memory, and mental sharpness well before someone would describe themselves as anemic in the traditional sense. As kidney function declines further, this kind of anemia becomes close to universal, affecting nearly everyone with advanced kidney disease. A useful comparison isn't yesterday, it's a year ago. Ask honestly whether tasks that require sustained focus, paying bills, following a recipe, keeping up with a conversation, take noticeably more effort now than they did 12 months back, and whether rest actually restores you the way it used to. Try noting, for 2 weeks, which specific tasks leave you unusually drained, and whether that's a genuine change rather than how things have always felt. This is also the sign people most readily explain away. Poor sleep, stress, thyroid changes, and simply aging all cause real fatigue, and often that's the entire explanation. A basic blood count can rule several of those causes out fairly quickly and is a reasonable first step, regardless of what's ultimately behind the tiredness. But when persistent tiredness and mental fog show up alongside puffy eyes, cramping, taste changes, or changes in urination already covered, it stops being background noise and becomes one more piece of a larger pattern. None of this replaces a real medical evaluation, and ongoing fatigue always warrants a conversation with your doctor. 2 down. Sign number 1 is the one I promised you at the start, and you can check it tonight. Here's a distinction almost nobody outside a nephrologist's office knows how to make: the difference between bubbles and foam. Bubbles are large, clear, and disappear within a flush or two, and they're completely normal, especially with a strong urine stream or a full bladder. Foam looks different. It's finer, whiter, and it lingers in the bowl even after you flush, sometimes looking almost like the head on a poured beer. That distinction matters more than it sounds like it should. Foam that persists is usually a sign of protein in the urine, a condition doctors call proteinuria. Healthy kidneys are supposed to keep protein molecules inside the bloodstream, where they belong. When the kidney's filters get damaged, protein leaks through into the urine, and that protein changes the surface tension of the liquid, which is what causes the foam to form and stick around. According to research published in the Clinical Journal of the American Society of Nephrology, roughly 1 in 3 people who report foamy urine turn out to have measurable protein leakage on further testing. Here's why this sign earned the top spot. It connects directly back to nearly everything else on this list. The same protein leak that causes persistent foam is often the very same process behind the puffy eyes in sign number 6, since both trace back to protein escaping the bloodstream instead of remaining inside it. Seeing the foam is, in a real sense, watching the mechanism behind several of today's signs happen in front of you, which is part of why nephrologists take a simple bathroom observation this seriously. Chronic kidney disease affects an estimated 37 million Americans, and the earlier that leak gets caught, the more treatment options tend to be available. The test itself takes about 15 seconds and needs no equipment. After urinating, glance at the bowl before you flush. Notice whether what you're seeing is a handful of large bubbles that vanish quickly, which is normal, or a persistent white layer that's still there after a flush or two, which is worth paying attention to. A useful mental image, courtesy of nephrologists who use it themselves: normal bubbles behave like soda fizz, gone in seconds, while concerning foam sits and holds its shape the way a head of foam does on a freshly poured drink. Doing this once means very little. Noticing it happening regularly, especially over several weeks, is the real signal. Keep this in perspective. This isn't a diagnosis, and one foamy trip to the bathroom after a strong stream or a bit of dehydration doesn't mean anything is wrong. It's meant to turn a vague sense of, "my urine looks a little different lately," into a specific, useful observation you can describe accurately to a doctor instead of a shrug. If you notice foam that lingers on a regular basis, especially alongside 2 or more of the other signs covered today, that combination is worth a call to your doctor this week. A simple urine test, often just a dipstick in the office, can confirm whether protein is actually present and how much, and it's one of the most inexpensive ways to catch kidney trouble early. One last caveat because it matters. Foamy urine has causes beyond the kidneys too, including a fast urine stream, mild dehydration, and certain medications. Uncontrolled diabetes can also spill excess glucose into the urine alongside protein, which is another reason a proper lab test matters more than a guess from the bathroom alone. This test is a prompt for a conversation, not a self-diagnosis tool, and it doesn't replace real blood work or a urinalysis ordered by a physician. Please treat everything in this video as general education rather than personal medical advice, and bring any concerning combination of these signs to your own doctor rather than relying on a video, however well researched, to make the call for you. 6 signs, 1 simple look in the bowl, and a pattern that's easy to miss when each piece shows up on its own. Puffy eyes in the morning, cramps that strike at night, itchy skin lotion won't fix, a metallic taste that dulls your appetite, fatigue that sleep doesn't solve, and foam that lingers after you flush. None of these 6 proves anything by itself, and that's worth saying plainly before we close out. But if 2 or 3 of these sound familiar, that's genuinely worth bringing up honestly with your doctor, not something to explain away as ordinary aging for another year while it quietly continues in the background. Which of these 6 surprised you the most? Drop it in the comments below. I read every one, and your answers genuinely shape which topics we tackle next on this channel. If this kind of research-backed breakdown is useful to you, consider subscribing so you don't miss the next one, and share it with anyone in your life over 60 who might benefit from knowing these 6 signs. Early kidney disease is genuinely manageable in most cases, especially when it's caught before symptoms progress, which is exactly why noticing these 6 clues sooner rather than later matters as much as it does. Take care of those kidneys, and I'll see you in the next video.